What are the causes of torn ACL in the dog? There's three primarily. One of them is conformation. How is the dog built? How does the femur tie into the tibia? There's something more complicated called tibial plateau angle, and basically that talks all about the conformation or how that knee's built. That's the first thing. The second thing is the fact that we spay and neuter our pets, okay? Spaying and neutering, although it's great for population control, it may not be the best choice when you're talking about tearing of ligaments. Let me give you an example. So when you spay or neuter your pet, you remove the estrogen, the testosterone, and a variety of other hormones that lend and give pliability to that ligament. So when the ligament's stretched, when a dog's chasing a squirrel or doing something else, if you don't have estrogen, then lots of times that ligament cannot stretch and come back to its normal anatomy. It will stretch and tear. And the third thing is excessive weight. Okay, the more weight you have on these soft tissue structures, the more they stretch and ultimately tear. So the big three things are conformation, and certain dogs have more propensity to do it. Number two, it's the fact that we spay and neuter them. And then number three is the excessive weight from overfeeding and lack of exercise. What are the Eastern or alternative options for a dog with ACL? The Eastern medical options are Eastern herbals, which there's a variety of herbals to give depending on the dog's constitution, depending on the signs, the chronicity, and actually the Eastern diagnosis. And then acupuncture. Acupuncture is great at mitigating and alleviating pain. Now, the Eastern medicine will not help the instability if that ligament is torn in its entirety. That's a big thing to know, okay? But some of our Eastern medicine techniques can help with the pain, inflammation, but it's not going to help with any instability. Another option is what's called prolotherapy, which is an injection technique. Now that's not Eastern medicine. That'd be more of a Western medicine. But the idea behind prolotherapy is you inject an irritant, something that irritates the soft tissues, and the way they respond with an internal cast, okay? Or an internal tightening or strengthening of those soft tissue structures that help with the instability of the ligament. So there's a lot of different alternatives. It depends on your dog's age, how bad it's torn, what your goals and aspirations are, how much improvement do you want to see. So there's other Eastern options and there's other Western options besides just surgery. That's important. That's something you need to know. Or you can add those, if your dog has to have surgery, you can add those additionally to the treatment protocol. So the common symptoms you see if your pet has a torn ACL, the number one obvious one is limping, okay? And that limp can be profound or it can be very subtle, and it can even come and go. I mean, dogs have an incredible way of recovery and hiding and masking a problem. But the number one symptom is limping. The second is getting up slowly, okay? Many dogs, when they are asleep and they have to get up, they'll get up, they may just, act stiff, and then after 3 or 4 strides, they kind of work out of that stiffness. That is another symptom of torn ACL in the dog. So what you're going to notice basically is limping or some sort of ambulation difficulty of them just getting around and performing normal everyday activities. So what will be the end result if you don't surgically fix your dog's ACL, okay? So what happens is dog tears its ACL, and then you get the development of arthritis. And so one of the arguments of doing surgery is that you'll limit the progression of arthritis. I don't subscribe to that. I think you're going to get arthritis regardless. The question is, what is going to be the end result? And some of that depends on how fast it's fixed after it's torn. But generally speaking, most dogs will do well fixing an ACL surgically. It doesn't matter what technique you use. They do reasonably well as long as the patient selection is correct. But the end result, which you'll probably have to manage at some time in your pet's life, is going to be arthritis. Now, when you have to manage that, it depends on when you do surgery, how long it's been torn. There's a lot of factors, and your veterinarian should be able to tell you that off the x-ray. But generally, you need to expect that at some point in your pet's life, you're going to have to manage arthritis in that knee. So what breeds of dogs are most likely to tear their ACL? Well, I think you need to divide that out into small breed dogs and large breed dogs, okay? Large breed dogs, I would say the most common are going to be Great Danes, Labrador Retrievers, any mixed breed dogs that have lab in them, and probably bulldogs. Those are probably the most common larger breed dogs. They're dogs over, say, 40 or 50 pounds. Smaller dogs, you know, Jack Russell Terriers do it, Yorkies do it, a lot of smaller breed mixed dogs do it. So, but the classic is going to be the Golden Retriever and the Lab as large breed dogs, and the smaller dogs are going to be the Yorkies and probably the Jack Russell Terriers. Those are the classics. Can a dog recover from a torn ACL without surgery? Well, that depends. Generally speaking, dogs 25 pounds or less, if you give them adequate time and you treat them with joint protectants, joint lubricants, and or NSAIDs, absolutely. I'd say the vast majority of them will recover with time. Bigger dogs or more active dogs sometimes can struggle with that. I mean, dogs can adapt and they can do well without it. But when you're talking recovery, you're talking a full recovery. And I would say, generally speaking, bigger dogs have more trouble. Dogs over 50 pounds, lots of times they won't. You know, they can be nagging injuries over time that you either have to fix surgically or do something else to try to help those dogs heal. But the big thing to know is dogs 25 pounds or less, absolutely, they can recover without surgery. Is a dog in constant pain with the torn ACL? And what I would tell you is that there's two components to it. One of them is pain, and generally they are in constant pain. Now it can fluctuate, it can be intense, or it can be subtle. The other thought to it is there's an instability factor. When that ligament is torn or damaged, and you know, when they put weight on it, it's unstable. Okay, there's nothing holding the femur on the top to the tibia on the body, so there's instability there. But I think the take-home message is that most dogs are in some degree of pain that's constant, depending on how they use it while it's injured, and if it heals on its own or it doesn't heal on its own. Typically, ligaments don't heal on their own, but a lot of dogs can figure out and adapt and function normally with a small, mild amount of pain. But overall, I would say the vast majority of dogs with a torn ligament are in constant pain. It just can vary. How long does it take a dog to recover after ACL surgery? Well, it depends. It depends on a couple of factors. Number one, it depends on what kind of surgery you do. If you do a bone cutter, a TPLO or TTA, usually those dogs are walking really good a week or 10 days after surgery. Okay, that's one of the big benefits of them. But the leg's broken, and it takes roughly 6 to 8 weeks for that bone to heal. And so during that time, you can't be confused about your dog's progression, because you still have to keep them from running, jumping, and playing, or else they'll break their leg. Okay, the bone is still broken. For a stabilization technique like a lateral suture, what I tell people is generally they should be toe touching in 10 days, but basically it'll take 4 to 6 months for you to know what you have. And the rationale behind that, the stabilization techniques, they cause an internal cast in the leg, okay? And so for that cast to develop takes about 4 to 6 months. Also, there's usually profound muscle atrophy that occurs. And so usually it takes 4 to 6 months for that muscle to grow back or to strengthen back to have some muscular control over the leg after the surgery. So basically, I would tell you that at a minimum, it's going to take 2 to 3 months, a maximum 6 months, depending on the surgical technique. I'm Dr. Marc Smith, Natchez Trace Veterinary Services, Nashville, Tennessee. We've got a Labrador dog here that had a cruciate surgery. And I often get the question, what do I need to do, Mark, after the surgery so that my dog's not in pain, so that I can give him or her the best chance to heal? And today I'm with Chrissy, and Chrissy's going to show us some of the rehab exercises that we institute right after the surgery, 24 hours after the surgery. So Chrissy, show us where the stifle is. So Chrissy's right hand's on the stifle, and then Chrissy's left hand, show us where the hock is. Chrissy's left hand's on the hock. So what Chrissy's going to do is she's going to take you through some range of motion exercises, okay? And for our viewers out there, Chrissy, tell them, how do we do this when our dog just had surgery and it hurts?
You make sure that you give the pain medication 30 minutes before you intend to do your rehab exercises. and apply an ice pack for 10 to 15 minutes immediately after to the surgical site.
Okay, and lots of times when, you know, the hand that's on the stifle or Chrissy's right hand, it's going to be painful, it's going to be hot, it's going to be swollen, it's going to have some crepitus or some crackling in it. Those are all normal findings, but it's very important to do these exercises starting 24 hours after surgery. How many times a day do we do them?
3 times a day for 10 to 15 repetitions.
Okay, that's a minimum. I'd probably tell you to do them as many times as you can. Just do the exercises. And what these exercises do is they break down the adhesions that start to form as this tissue begins to heal. And it allows your dog to use their limb ultimately in the full range of motion. Okay, and so how long do we do these as far as days after surgery? When do we consider switching to a different type of rehabilitation exercise?
At suture removal, when you return for your follow-up with your veterinarian.
Okay, so Chrissy has explained to us today the flexion extension exercise that we implement directly after surgery, and we keep it up through suture removal, which is 10 to 14 days, and then we'll go on to different exercises. I hope this answers some of your questions on how to handle dogs post-operatively from a cruciate ligament surgery.
So the day after knee surgery, be it TTA or a TPLO, you're going to do your range of motion exercises. And what you want to do is take your hand and place it behind your hock, and one hand over the surgical site and the stifle so you have control of your leg. And you're just going to flex the leg up towards the body as far as your dog will let you. And then you're just going to extend it in a fluid motion. And you want to go kind of slow. You might have to give just a little bit of a push towards it just to break down some of the scar tissue and swelling. But you just want to go slow and controlled. Always keep control of the joint. And you're going to do about 10 to 15 repetitions 2 to 3 times a day. After this, you're going to take them for a slow and controlled 5-minute, very brief leash walk. They may or may not put pressure on the leg, and that's to be expected the day after surgery, but it'll be 5 minutes for the first week of leash walk 2 to 3 times a day. And after you've done your range of motion exercises, which is what I'm doing now, and you've done your walk, you're going to apply an ice pack. It can be a human gel pack or even a frozen package of vegetables that you have in your freezer. Just something that'll bend and flex around the joint. Put an old washcloth or some kind of barrier between the skin and the actual cold pack though, because you don't want to freeze the skin and burn them. And that's the basics of the very first week after surgery.